Hello everybody. Today we'll be discussing pancreatitis. My name is Jeff.
I'm Sidra.
And I'm Chris.
The pancreas is an organ inside the abdominal cavity, just underneath and right behind the stomach. It has two primary functions. The majority of it is to excrete enzymes into the GI tract, which is its exocrine property. These excretions are enzymes that help to promote and break down food for digestion. The second one is an endocrine action, which secretes hormones and insulin straight into the bloodstream. So I believe it's the only organ that has both exocrine and endocrine function. Pancreatitis is inflammation of the pancreas, and it can be both acute and chronic. Acute pancreatitis lasts only a day or two, maybe 3 to 4, but it doesn't last long term, where chronic pancreatitis does last long term. Many causes of pancreatitis can be alcoholism. It could be gallstones that block the common bile duct. It could be cancer. It can be caused by different medications. Basically what happens is the pancreas builds up its enzymes and wants to excrete them into the GI tract, but it runs into gallstones, which then back into the pancreas, and those enzymes start to digest the pancreas itself and not the food that we eat. Some common side effects are fever, which indicate infection, loss of appetite, severe abdominal pain, sweats, vomiting, chills, respiratory distress, and tachycardia. Next, Sidra will be discussing common lab values, some collaborative treatment, and medications.
All right, I want to talk a little bit about some important lab values that we're going to be seeing with acute pancreatitis. Some diagnostic lab values will be an increase in serum lipase and serum amylase. The serum amylase will be elevated for 24 to 72 hours. So serum lipase will help rule out other illnesses such as cerebral trauma. Serum amylase is going to be elevated in these other conditions. Other lab values that we'll see are going to be an increase in liver enzymes, triglycerides, bilirubin, and also a decrease in calcium. All right, I'm also going to talk about important medications that we're going to be seeing in acute pancreatitis. One of the important things we're going to take care of for our patients is pain. They're going to be experiencing a lot of abdominal pain. So we're probably going to be giving IV morphine and also antispasmodics as needed for our patients. We also want to prevent and alleviate shock. So our patients might be on O2 therapy, especially with severe pancreatitis. They might also need insulin therapy in the case of hyperglycemia. They also may need blood volume products in the case of shock. And we also want to be reducing those pancreatic secretions. So the first thing we want to do is put our patient NPO. The second thing we want to do is start nasogastric suctioning. And then the third thing we want to do is decrease those gastric secretions. So we're going to be using antacids, proton pump inhibitors, and also carbonic anhydrase inhibitors. And we also want to be correcting any fluid and electrolyte imbalances. So IV fluids are something we're going to see our patients on. And lastly, infections is a huge problem with acute pancreatitis. So we're going to see our patients on different types of antibiotics. All right, I'm also going to be talking about ways in which the nurse is involved in acute pancreatitis. Nurses are going to be involved in health promotion. We're going to be assessing our patients for predisposed factors and any etiologic factors that can cause pancreatitis. We want to encourage early treatment of any of these factors. We want to encourage early diagnosis of biliary tract disease, and we want to eliminate any alcohol in our patients, especially if they have small attacks. Nurses are also involved in acute care, so things we're going to be doing in the acute care setting are, of course, monitoring vital signs, and they are at risk, our patients are at risk for fluid and electrolyte imbalances, and this is due to many of our patients will experience vomiting and also from the nasogastric suctioning. And this is going to lead to the low chloride, the low sodium, the low potassium levels, and we definitely want to be monitoring for respiratory function, as in severe pancreatitis, they can go into ARDS. We want to be monitoring for respirations and also listening to lung sounds. We're also going to be monitoring our patients for abdominal pain and giving them pain meds as necessary. And we want to make sure we're giving our patients good oral care and nasal care, and that's from the oxygen and also the nasogastric suctioning. And lastly, we want to make sure we're watching for signs of infection and making sure if they do have surgical wounds that we keep a close eye on them. And lastly, as nurses, we also want to make sure our patient is safe when they go home. So we want to make sure our patient has access to the physical therapy they need to recover, and if alcohol is involved, that they do get the help they need with any alcohol treatment programs. And if they are smoking and they want to quit, we really need to encourage that, because smoking is going to increase those pancreatic enzymes, and that's something we don't want to do. And we also need to do dietary teaching. We need to keep our patients on a low-fat diet, make sure they're not binge dieting, and we need to do a lot of instructing with the caregivers as well. We need to make sure the caregivers understand signs and symptoms of infection. We also need to be teaching them a little bit about what diabetes is and how to look out for those signs of diabetes. We also need to be telling our caregivers to watch out for foul-smelling stools, and just letting our caregivers know, as well as our patient, to contact the healthcare provider as soon as possible, as any of these could be signs of pancreatic issues. And now Chris is going to talk to you about nursing diagnoses and also complications.
Next, we're going to talk about potential nursing diagnoses. The first would be activity intolerance. Now, if you think about it, your patient is probably going to be in severe pain and probably not going to be eating. And because of these issues, your patient's probably going to be on bed rest and have generalized weakness, as well as possibly some imbalances of oxygen with supply and demand. And this is due to maybe some pH problems within the body or chemical problems that are affecting the breathing. Another potential nursing diagnosis would be anxiety. And this is related to change in environment, from possibly your patient has never been in the hospital and now they're in the hospital now. Threat of health status. The patient doesn't know whether or not they're going to be okay or not. Potential exposure to toxins that the pancreas is sending out into the body, and also some situational crises such as stress or substance abuse if your patient has been abusing alcohol. The third nursing diagnosis that I want to talk to you about would be ineffective breathing pattern, and this would be related to either anxiety or pain, hyperventilation or hypoventilation due to changes in the pH of someone's body. Risk for electrolyte imbalance. This is related to endocrine dysfunction, fluid imbalances such as dehydration, impaired regulatory mechanisms such as diabetes, as well as renal dysfunction and vomiting. Risk for infection, and this is due to inadequate primary defenses, stasis of body fluids, altered peristalsis, change in pH of secretions, immunosuppression, nutrient deficiencies, and tissue destruction. Nausea would be a sixth nursing diagnosis, and this is related to possible pain or toxins. Imbalanced nutrition, less than the body requirements, and this is related to biological factors of inability to absorb nutrients, inability to digest food, inability to ingest food, and psychological factors. And we see this with people with pancreatitis because they have pain, and so they do not want to eat. They have lost their appetite. Also, the pancreas is one of the primary organs in digesting food, and so they may have an inability to digest that food as well. And the last nursing diagnosis that we have is acute pain, and this is due to the obstruction of the pancreatic or biliary ducts. Some possible complications of pancreatitis can be pseudocyst, which is a pocket filled with fluid and debris in your pancreas. A large pseudocyst that ruptures can cause complications such as internal bleeding and infection. Breathing problems can occur, and this is because acute pancreatitis can cause chemical changes in your body that affect your lung function, causing the level of oxygen in your blood to fall to dangerous low levels. Diabetes is another complication. Pancreatitis can lead to the damage of insulin-producing cells in your pancreas, which can lead to diabetes. Malnutrition. Both acute and chronic pancreatitis can cause your pancreas to produce fewer of the enzymes that are needed to break down the processed nutrients from your food you eat. And the last complication that we have is pancreatic cancer. Long-standing inflammation in your pancreas caused by chronic pancreatitis is a risk factor for developing pancreatic cancer.